So the introduction, we're going to talk about the who's, what's, and where's. So in a society that is facing more and more challenges surrounding substance abuse and addiction, the accessibility of life-saving medications like buprenorphine has become more important in paving the path towards recovery and harm reduction. For my capstone project, I will be exposing imperative use of buprenorphine availability and its potential to revolutionize addiction treatment, specifically within Lincoln County. According to Gateway Foundation, the black cloud stigma hinders people from reaching out and getting the help they need. This forces addicts to continue to fight their addiction themselves, and more often than not, they never win. As a result, over 1 million EpiPens are used annually to treat drug overdoses. So by shedding light on this critical issue, I aspire to advocate for policy changes, destigmatize addiction treatment, and develop a more compassionate and inclusive healthcare system within Lincoln County that prioritizes the well-being of all individuals, especially those grappling with addiction, by promoting preventative drug use and medication and making it easily accessible as possible. I hope to reduce the damages being caused by drug use. I believe we pave the way for a future where individuals are empowered to seek help without fear or shame, and where buprenorphine serves as a go-to for fighting against opioid addiction. So going back through that, what is the purpose here? So the purpose of it is to address the issue of buprenorphine availability. That's what I'm focusing on, buprenorphine specifically. There's other life-saving medications, but I really like buprenorphine and I wanted to focus on it for this one. And I found it really imperative to focus on my own community of Lincoln stigma surrounding it. And improving the access to effective treatments like buprenorphine, hopefully people will reach out and there will be less stigma surrounding that. We also have alarming statistics such as 1 million EpiPens being used every year for drug overdoses. This kind of emphasizes and reiterates the purpose of trying to lower this and fight these addictions. So what is buprenorphine? It's hard to really make an opinion or really talk about it unless if you don't know what it is, and a couple of you probably know. I'm going to play a quick little, which is the real key idea here, is that it is growing. It is becoming more and more of a problem. So the data illustrates that the epidemic opioid crisis is leading to, with all community members recognizing that there is a crisis that needs to be addressed, and overdosing increases at all-time high, life-saving proactive measures like buprenorphine, other than reactive measures like EpiPens, is at an all-time need. The stigma and judgment drug users receive hinder them from reaching and begin recovery, thus pushing for a discreet and judgment-free option. When surveying members of Lincoln County, I got the opportunity to speak with an addict themselves. When prompted the question, is there a stigma surrounding addiction treatment, I was provided insight with his own experience. He said, people don't want to admit they have a problem. They don't want to get help because they don't want people to know they have a problem. From someone who battled in seeking treatment for a while before doing so, we learned that is there any questions?
How many were in your data, or the data when you were asking people the questions? How many people were in that?
Oh, on the form? I had 52 responses. Okay, thank you guys.
I have another question.
Oh, okay, I'm sorry.
No, that's okay.
Sorry.
What's the cost?
The cost of buprenorphine?
Uh-huh.
So that's challenging because if you go to your physician, most times insurances will sign off on it and pay for it.
Okay.
But we're finding that most users don't.
So I'm Abby Hardy,
I'm Elizabeth Gutermuth.
and our capstone project is over the lack of women's health in Lincoln County.
So recently we read an article, and it was from Fox 2 News, and they stated that Lincoln County was named a maternity care desert. So based on that, we decided that we should try to make a solution for that. So our problem that we were working on was finding an option to have more clinics in Lincoln County and not just like in Troy. So we have SSM Health right now, and then we have Oasis, but they're kind of like located in Troy, and we were thinking that's not very ideal for like people that live in Silex, Ellsbury, Winfield. Like they have to have a 30-minute commute each way. So we decided that we are going to make more clinics in Lincoln County.
So to further research this problem, we first wanted to start by researching the clinics that are in our community now, which is SSM Health and Oasis. So we went to their websites, we looked it up, and then from there we wanted to research our community. So we went to World Population Review and researched like the percentage of women below the poverty line, things like that. And then we actually interviewed, so I interviewed my mom, who is a nurse manager at a women's healthcare clinic in Bridgeton. And then I interviewed a client associate manager at Oasis. And then from there we sent out surveys to our community to see what they thought, they think that we need more within our community.
So here's a little bit about the two that we have right now. So Oasis is a nonprofit that does not currently have any doctors or nurses on staff, and they operate under a medical director, and it mostly acts as a maternity resource center. And SSM has many more options for women's health, including breast exams, gynecology, well women's, and more. Unfortunately, it is not accessible to lower income women in the area.
So as far as our community research, like Beth said before, both clinics are in Troy, which could mean a 30-minute drive. I know that some cities will have, they can go to Lake St. Louis and things like that, but for like Silex, that's a pretty decent drive to get here to find some good clinics and healthcare. Our population has been steadily increasing for the past couple of years, and then we've seen an increase of 25.71% since 2010, and so we definitely need more than two healthcare resources for women. And then within the poverty line in Lincoln County, 42.05% of that is women, both employed and unemployed.
So looking at these graphs a little bit, obviously we have Lincoln County's population and how much men and women make compared to each other with the degree they have. And obviously you can see that males make quite a bit more than women. And so we kind of wanted to show something that showed that the female unemployed is very high, and that we would like to get that where that they can be able to go to clinics and not be able to go because they don't have money or anything.
So we sent out some surveys to the We Love Troy page, which unfortunately doesn't reach our whole community, but it does reach a large part of it. And just in Troy where there is clinics, we got these responses saying they could definitely use more help. We asked about what they thought the women's resources were like now, if they were enough, and the possibility of opening other clinics. We had 111 responses, and the turnout was very clear that we need more resources.
So our solution to this problem is we wanted to add 3 nonprofit clinics, and that would allow women in our community to have more resources they need so they can get the help that they need. So
as far as our implementation, like Beth said, we do want to have 3 clinics that would be more spaced out across the county. To figure out exactly where we want to put them, we would want to do a little bit more research. We probably wouldn't want to put another one in Troy, but we would want to put one farther north for sure. Within the clinic, we hope to have resources such as pregnancy tests, diapers, ultrasounds, STD testing, and gynecology, and hopefully more breast exams, well woman checks maybe. As far as the cost, unfortunately the cost for a clinic is a lot, and it can vary by what you need and how big you want it to be. So the cost is anywhere from $82,000 to $395,000. So that would be our biggest obstacle, and we would hope to receive that through grants and state fundraising. And I believe we could do that just because of how much our community has said that we need this, and it's clear that they want it. We decided our clinic would be open from 1 p.m. to 9 p.m. to allow for easier access for women, working women, especially if they're below the poverty line. They're not going to want to take off their work to come in. And I know even my parents have a hard time getting in just to cut their hair because it closes before they get out from work. So to curb the struggle of finding doctors and nurses and staff, we'd want to appeal to local Catholic hospitals and hopefully get them to work maybe 1 to 2 days a week, just to have some true doctors and nurses. And then also we would want to go off of volunteers, since it will be a nonprofit. And then as far as training, when I interviewed Stacey Phelps from Oasis, since she works for a nonprofit, she said that policy and procedure are extremely important in making sure your patients have the best care, especially with volunteers who haven't been trained in the medical field. They sometimes will give their own opinions or not say the right thing, so I think we would go over a similar training that they give you at Troy Mercy and just demonstrate like what the patients need, the patient's rights, and just to keep our opinion out of it, I think would probably be the best thing.
So in conclusion, having the resources and accessibility in Lincoln County would make a very positive change and would help support women on so many new levels of their lives, making a change in the community to help women by creating clinics that are open later hours will solve a huge problem women in Lincoln County are facing right now. And our next steps would include receiving more community feedback, draft a layout for our clinics, and begin to fundraise to gain the resources needed to help women live in a community that can support them and the needs they need.
Resources. So thank you guys so much for your time. Do you have any questions?
How did you come up with what resources we have in this county?
Like the current clinics?
Yes.
We started by just a simple Google search of women's healthcare resources in the county. We just looked up like what's around us in Troy and in Lincoln County, and we're going to take the hospital into account as well. But unfortunately, that's not really much of a resource, especially to women. Like it doesn't have a labor and delivery floor or anything like that, or very much resources for women just to go get an appointment or a well-woman exam. So we didn't include that. But
There is a NP, Women's Health NP, at the clinic in the hospital.
doesn't she only come a few days?
She does, but it is another resource.
So yeah, I wasn't sure about the clinic. I thought she came on Tuesdays and Thursdays or something. And then there also used to be a home birth place, but I believe that moved out already too, so we didn't include that.
And the health department's doing STD
Yeah.
testing and treatment as well.
Mhm.
Again, so that's another one.
Yeah.
But yeah, maybe advertisement and
Yeah.
Where would you like to put your 3 clinics?
We were thinking like somewhere more like towards 79, so that it's like Winfield, Foley, Ellsbury, kind of over there. And then we were thinking maybe one like on 61, like kind of like by the Bellman dealerships or somewhere, a little bit closer to Silex. And then one kind of like out by Hawk Point, preferably. Any more questions?
nope.
Okay, well thank you for your guys' time.
Thank you.
Thank you.
Good morning.
Good morning.
I'm not gonna lie, I'm pretty nervous, but
Deep breath.
I know. So, my name's Cameron Huddleston. I will be presenting my capstone project on emergencies in the ER. I just want to start this presentation off with a couple eye-opening facts that I found during my research. A study done from 2006 to 2016 found a 4.4% increase within hospital spending on ERs. Compared to the only 1% uptick in other hospital sectors, that seems like a pretty large increase to me. Sorry, I keep moving my iPad here. So, local statistic, in 2021, the poverty rate within Lincoln County was 10.8%. This grew 20.5% from the previous year. With 65,000 individuals, that's about 7,200 individuals who are struggling under the poverty line. So, going into this project, just a little understanding of what this is. It's basically uninsured individuals within Lincoln County are increasingly relying on emergency rooms for primary care and basic needs, even though they have urgent care opportunities, but they can't because they don't have insurance, stuff like that. These stem from the Emergency Medical Treatment and Labor Act, which states that, patients will receive treatment and care before they have a conversation about payment. So that only applies to ERs, unlike urgent care and primary care sources. This can lead to overcrowding and overuse of resources, which is seen within Mercy Lincoln, because I shadowed and interviewed a couple of their staff, which they stated that there is a shortage of nurses and that they feel like a lot of the patients who are coming in can be treated by simple urgent care or over-the-counter medication, and they're taking up rooms in their time. So urgent action is needed because we're a growing community and you need a strong healthcare to keep a community healthy and grow. My ultimate goal for this is to create a strong pillar for our community to grow off of, and I think starting in the emergency room, which has 24/7 access, is a very important start, because if we have an issue with people needing to get help in that emergency, then why would they want to live here? So the research and data that I conducted from a national and a local setting, just a little quick national level, there was around 140 million visits to the ER just in the last year. Wait times on average were about 135 minutes compared to the wait time for Mercy Lincoln ER, which was 150 minutes. This also, within Mercy Lincoln, they roughly have 194 patients per day, which can lead to a 4-to-1 patient to nurse ratio for that entire day. Another fact that I found that I thought was pretty substantial was the 9,836 patients to 1 for patient to primary care physician. I think that's a pretty large number for just one primary care source. Along with around only a 14% of uninsured adults that are unable to reach a primary care setting. And as these graphs show, this is just a population of Troy increasing. And then Lincoln County uninsured adults are increasing at an alarming rate, along with at a national level, this is payments. I know it's kind of small, but the uninsured is down here, and it grew from 20% to 22% for the payment type. Solution and execution. The solution that I thought of throughout the research and data provided was a freestanding ER. Similar to an urgent care, the only difference is the Emergency Medical Treatment and Labor Act. That helps patients be able to just come in and use it basically as their primary care, but it's for the people who need that accessibility and they need the help financially. So the objective one was just the research. I compared local and national statistics, and I interviewed the Mercy Lincoln staff. The objective 2 is the implementation of freestanding ERs. We would hopefully get financing through investments, grants, and maybe even increase taxes, because as a community this is something that I think we need. So I think people would be more than willing to pay a little bit more for that extra care. And then objective 3 is just the longevity of freestanding ERs and how that can, how they use it as a community, if it actually is being used, if it's beneficial, and if it's helping the congestion with nurses and how they feel. Conclusion. Throughout my research, I have found a lot of issues, primarily from the Emergency Medical Labor and Treatment Act, but the nurses and patients themselves also feel like this is an issue, because wait times are long and it's very hard to just be able to pay for medical bills. And I think that patients who are coming into the ER, they're struggling, and as a community we need to help lift those patients up. And even as the nurses stated, most of the patients who are coming in are simple urgent care patients who just need simple checkups, stuff like that. And then citations. Yeah. And I really went very quickly. I apologize.
That's okay.
I am opening to questions.
Have you looked into, are any other communities doing this already? And if they are
Freestanding ERs?
successful? Mhm.
Freestanding ERs, yes. I don't know what communities exactly, but I know freestanding ERs exist and that they have been beneficial and they lower the congestion rate within hospital ERs, which is the problem that we have in Lincoln County.
What's the difference between an urgent care and a freestanding ER?
One, the Emergency Medical Treatment Labor Act, that, and patients who go to urgent care typically have insurance and they make those appointments and they have to wait a little bit, but with the freestanding ER, it's quick, it's easy, and the freestanding ER has more resources as well. Anything else? All right. Thank you so much for you guys' time. I appreciate it.
I'm Sadie Joseph,
And I'm Hannah Easterday.
and today we're going to be presenting to you our capstone project, which is entitled Narcan Now, Accessible Vending for Life. Sorry. So we first wanted to start out by giving you guys some statistics. So that first number up there is the amount of people that died due to overdosing on narcotics in the year of 2022 at the national level. And then at the local level, in that same year of 2022, 28 people died in our own community of Lincoln County due to overdosing on narcotics.
This brings us to our problem. The Missouri Health Department and Senior Services reported that the #1 leading cause of death was due to drug overdose, usually between the ages of 18 and 44. And within our own county of Lincoln County, the mortality rate linked to drug usage has surged to a staggering 87%, so it's definitely increased. After identifying the problem our community is currently experiencing, we wanted to create a solution which is present within our mission statement here. We believe a great way to combat the rising issue of drug abuse is to implement free and accessible Narcan vending machines throughout our community. Our main goal is to spread awareness through educating individuals on the impact of drug usage and decrease the overall death rate within our community.
So as Hannah just said, the solution we decided to come up with was free, accessible Narcan vending machines. So we believe by implementing this, it'll hit on 3 main impacts. The first being accessibility. Narcan would become accessible to anyone who needs it 24/7. So right now in our community, people are able to get Narcan from the Lincoln County Health Department for free, but it's only during their open hours. So this would become available 24/7. It would also hit on education. Of course, we want our community to be educated on Narcan if we're making it free and accessible to them. So with the help of the Lincoln County Health Department, we would be able to spread awareness and information through educational classes that would be given to the community. And it would also hit on first aid and first responders, as we would have first aid products as well as Narcan in these vending machines, or we thought we could have them, such as Band-Aids or gauze for people who need it. And it would also help to take off a burden of the first responders, as they're the ones being called to these overdoses normally.
After creating a solution to the issue, we wanted to see how our community felt about our idea and get feedback from the people of Troy as well as health administrators of our community. So we sent out a 10-question survey asking them questions that range from how they view drug abuse and its effects to how they felt about our Narcan vending machine. The 100 responses we received concluded that people definitely identified drug abuse as a problem, as well as they would support the implementation of Narcan vending machines financially and educational classes.
We also had a contact at the Lincoln County Health Department. Her name was Sarah Valenza. We also asked her a couple questions just to gain some more information. She said that the Lincoln County Health Department does view opioid and drug overdoses as a serious problem, and she told us that they do give out free Narcan during their open hours. They also said that they would be willing to support our implementation of these vending machines financially, and they would support providing those educational classes to the community as well.
Here we stated the initial steps we took during this project, starting with the first step of researching the most pressing issues within our community, and we came up with that drug overdose and abuse was definitely one of them. So that's the main target that we were going to try to highlight. The next step was to formulate an idea and solution to combat the rising issue that we just found, and we came up with a free accessible Narcan vending machine. And finally, we wanted to survey the community and about their thoughts to our solution, as well as contact health administrators to get their support, as well as more viable information.
We also wanted to include some steps for implementation if this idea were to be implemented in our community. So the first step would obviously be to purchase those vending machines. Now, a regular vending machine, it costs anywhere from $3,000 to $4,000. Our vending machines would probably cost a little more because of different things that we wanted to include on it, such as a help button. But as the Lincoln County Health Department said, they would be willing to help us financially, and we could also obtain the Narcan from the Lincoln County Health Department. The next step would be to place the vending machines throughout our community. So we believed that local parks, homeless shelters, first responder bases, schools, hospitals, and local jail would be good places to put these Narcan vending machines to reach the most amount of people. We decided to put them in schools, specifically school nurses' offices, to help with those students that may have parents that use drugs and their parents don't have access. So obviously we wouldn't just have a kindergartner going up to a vending machine and getting some Narcan, but we did want it to make it available for those students. And the final step is to provide those classes to anyone who's seeking to learn more about drug use, overdose, and how to use Narcan.
Next, we wanted to address any concerns and questions you may be wondering yourself, and also some that we came across while doing this project.
So the first, and probably the main concern that most people have whenever they hear about Narcan, is what if it's being misused? What if people are continuing to use drugs even after overdosing? And unfortunately, while this is a likely possibility, our main priority is to prevent deaths from happening due to overdose, and Narcan definitely is helpful in that. Lincoln County has a lot of rehab centers, such as the Troy Dream Center and LC Core, that helps with rehabilitation and people who are addicted, so there would be those options for them.
The second question we're going to be addressing is how and who restock the vending machines when they're low. Well, through the app of Vending Metrics, the LCHD staff will be able to see what products need to be stocked, as well as see the overall success rate of the machines all through the one's mobile device. We will be able to clearly identify whether or not these machines are truly making a difference within our community.
And the final concern we wanted to address is what if someone doesn't know how to use Narcan or they need aid right then and there? Well, we thought it was a good idea to maybe put a help button on our machine so that when it's pressed, the first responders are contacted and they're able to get to that scene and help that person administer that Narcan or provide any type of help that they need. So in conclusion, through the participation in our survey, as well as our contact at the Lincoln County Health Department, we decided that our community needs preventive and reactive measures for our drug use and overdose problem, and we believe that implementing these Narcan vending machines throughout our community, it's been accepted by our community members, and we believe it's the best way to solve this problem.
Here are our references, and we just wanted to thank you for your time.
Do you guys have any questions for us?
Do you know of anywhere that is currently using these?
So I did a little research to initially starting this, and I can't recall where, but I found an article that found success through using the Narcan vending machines, and that's where I based a lot of our research and overall project on. So, and then I believe Ellsbury possibly is implementing some sort of system as well, but
Yeah.
that's something we recently just found out. But yeah, I think Ellsbury as well is.
Do you know anything about it at all? About how they're gonna implement what they're
So
doing?
I believe
Is
it's just a box that opens and then there's just Narcan in there.
Gotcha.
So you can take as much as you want. So with our idea, if it could be different than the one in Ellsbury, where people could just take all of it. Like one person could just take all of it. Whereas with a vending machine, there would be ways to maybe limit maybe 2 to a person or things like that. So someone's not just taking all of it, and it's more, staff.
Did you think of how you could prevent vandalism within those boxes?
That wasn't something we had thought of or addressed.
Well, we put the ones in Ellsbury.
Okay.
We didn't either, and we've already
Yeah,
had to
really.
come across that. That's why I was wondering if maybe you guys thought about that.
Sure. So, just off the top of my head, I guess we could definitely implement some sort of security camera, in order to make sure monitoring who's a frequent user and things like that.
Yeah.
Don't let that discourage you. It
Yeah,
was just
no.
a one-time thing.
Yeah.
No, we
and
appreciate
it hasn't
the
happened
question.
since,
Sure.
but
Yeah, that's a great question.
Anything else?
All right.
Good
Thank
job.
you so
Thank
much.
you, guys.
Good morning,
Morning.
My name is Caitlin Fisher,
and I'm Liam Sontag.
and we are talking about first aid for the homeless. So for our introduction, we want to help provide medical supplies for the homeless or people who can't provide for themselves, such as food, water, and shelter. They struggle with getting first aid and any medical supplies because they can't get it for themselves.
Since 1870, homelessness has been a huge problem in the world. Around 2% of our world is actually homeless. And in our project, we want to help those who are homeless and can't get the resources that they need to take care of themselves. Such as donating bandages, wraps, protection for their feet, some rubbing alcohol to clean and sterilize their wounds. And then another thing we want to implement is basic CPR training to maybe further help them and so they can teach other homeless people about taking care of themselves.
So did you know that 70% of homeless people are men and 38% people are females? And Hawaii is the highest percentage of homeless people. And the life expectancy for homeless people are 50 years old.
In 2021, around 150 million people were actually homeless. And as I already said earlier, 2% of our world population is actually homeless. And then by providing first aid access to homeless, it will reduce health complications that come with being homeless.
So these are our results. We had a total of 194 people reply. Out of these 194, 119 people replied saying this is a very relevant problem all around the world. And 155 people think that homeless shelters are in need of first aid. Some things they suggested to provide for the homeless are wound care kits, bandages, any medical supplies they would need, and any kind of supplies they would need for any type of injury.
So our procedure that we did was we first created a survey, like a Google form, that we sent out seeing if people wanted to donate and seeing what they would like to donate. Then we posted it on social media platforms. We posted it on like the Facebook page, We Love Troy, or People of Troy. And then lastly, we gathered all the research and got an idea of what we could donate.
So in conclusion, our project developed the community about needing first aid for people experiencing homelessness, and we started the survey, and after the survey, we really seen how big of a problem it is and how people saw it was a problem, and it wasn't just a small group of people who were like, oh, this is a problem. It is a major problem. And we want to provide supplies for homeless people because I believe that anyone should have the opportunity to get care whenever they need and for whatever they need, no matter what it is.
Thank you.
Do you guys have any questions? Well, you guys have a good rest of your day.
Thank you.
Okay, can I ask you guys a quick question real quick?
Absolutely.
Okay. Do you think $16,000 is a considerable amount of money for like an average person?
Sure.
Well, on average, this is the amount of money that females spend on feminine products throughout their entire lifespan.
On average, a package of 36 to 52 pads is around $8, and 34 to 50 tampons is around $7.
Someone can use up to 6 or more pads or tampons in just one day, and throughout their cycle, that adds up to 42. This slide shows the content that will be covered in our presentation. So let's jump right in.
As we previously introduced the cost of feminine hygiene products, we're going to jump right into the effect it has on women in poverty. In Missouri alone, there is a 4.225% luxury tax on feminine products. These products are not, but should be subsidized by the government. Alone, this tax adds probably around like $2 to each product.
This then leads to women in poverty not being able to access these products. This can cause mental and physical health problems.
This issue then leads us right into our mission statement.
Covering feminine hygiene products under government subsidies will make accessing these products easier for women in poverty. In a study done in 2019 for low-income women, 2/3 stated that they had trouble affording these products.
Do you guys mind if I ask another question? Do any of you guys have any daughters? Have you ever or do you currently buy their feminine products for them? Okay, well, in most cases, your daughters are very lucky because not a lot of people have the ability for their parents who are more financially stable than them to purchase their products for them.
In my personal experience, I do have a part-time job with also going to school, and I have a car payment, I have car insurance, I also have to pay for gas, which makes me worry at the end of the month if I can afford these products.
Period poverty affects nearly every person capable of menstruating, which is half of the world's population.
When women overuse these products, it can lead to emotional distress. This can then lead to a decline in their attendance at school and at work.
An article that discussed the impacts of period poverty stated that the prolonged use of unclean products can lead to urinary tract infections and vulvar contact dermatitis.
This is the visual representation on the data we collected through surveys.
So what did the survey tell us? First of all, we had 57 women that chose to participate in taking the survey. 61.4% of women have or have known someone that has struggled at least once accessing these feminine products.
And 98.2% of those women have been in a public area where they were not able to get to the product that they needed because they simply had no change on them or the machine was just out of stock.
So next, we go right into our methodology. First, we gathered support from women in our community.
Our second step is to come together and bring a solid argument on why these products should be subsidized by the government.
Step 3 would then to present the argument that we formed to the highest available authority. That's maybe our local governor, our Senate, basically anyone that is willing to like listen, and we want to kind of start at the local level and then try to work our way up, but really we're kind of just focusing on what's happening in Lincoln County.
To conclude our issue, we conducted a survey demonstrating common problems, common opinions among many women. This survey and further research showed that period poverty is an issue not just here in Lincoln County, but also around the world.
Feminine hygiene is crucial to women's health, and economic changes must be made. Therefore, both of us proposed a plan to broaden the awareness of this matter and express to an audience why we should not have luxury tax on these products, or they should at least be subsidized by the government. This is the references we used in our presentation, and we'd like to thank you. Do you guys have any questions?
Where did you put your survey out to? Or
We,
what did you use, what platform?
We sent it out on social media.
Okay.
We like created a story full of all women that we all had that included age ranges. Like, I know like my mother was in it, my mother's friends, so it's not just like teenagers, it was grown adults too.
I also like texted it out to like older people in my family.
I just wondered why, because you only had 57 people. I would have thought there would have been.
Yeah.
I mean, just because looking at some of the others, like one of them had 194.
Yeah.
Through like We Love Troy or whatever.
Right.
So I just think it's interesting to see that not as many people will answer that, but they'll answer about homelessness or whatever.
Yeah. You guys have any more questions?
That was a good topic.
Thank you.
Absolutely.
Well, if any questions do come up, we do have our emails
We'd
right
like
here.
to jot them down or anything, but
Excellent.
it's where you best reach us. But we thank you so much.
Thank you.
My name's Hunter,
I'm Landon.
and I'm Alan. And our project was all over how caffeine affects your vitals. So what really kind of led us into this project is we noticed that in every classroom, we would have somebody, at least one student, drinking some sort of Celsius, some sort of Monster, some sort of energy drink. And we were just really wondering, how does this affect your body? So for our research project, we tested our subjects' heart rate, blood pressure, oxygen levels, and hand grip strength. The hand grip strength was a really fun one. Everyone loved it. I personally did it like 7 times. It was really fun.
So a lot of caffeine consumers don't exactly know what it is that they're consuming. And so when you look at caffeine, it's actually a psychoactive compound that you're going to find in a variety of beverages, such as sodas, teas, and of course the energy drinks that we're testing, but also it's found in chocolates. That's the one that I didn't really know of until we performed this research. And I actually did a little bit of side research. The average cup of coffee is about 80 to 100 milligrams per cup of coffee. An average soda is around 40 milligrams for a 12 ounce. And then different energy drinks. Red Bulls have about 80 milligrams of caffeine for 8.2 ounces. Monster has about 86 milligrams per can of Monster. And then a Celsius is way higher, that has like 200 milligrams. So that one is packed full of caffeine. Yeah, and a lot of people don't know that when they're drinking it. And Celsius is actually probably one of the most popular ones that we see in class that people bring in from, because they're always found in all the gas stations, Walmart, everywhere. They're always available, so they're just easy to get.
Yeah, and a really important thing is that according to the American Academy of Pediatrics, the recommended daily value for caffeine is less than 100 milligrams per day for ages 12 to 18. And that's shocking because most students drink multiple of these energy drinks a day.
And then you also, like outside of students, you look at the adults. What adult only drinks 1 cup of coffee? If they're a coffee drinker and you drink a cup of coffee in the morning, who just drinks 1 cup of coffee? And so with that 1 cup of coffee, if you're averaging between 80 and 100 milligrams in just 2 cups, you're already over 100 milligrams, and that is only up to 18, that data, but still, how much higher are you going to go whenever you go from 18 to 19?
So our hypothesis, we said that if one of our students, if one of our subjects drank or consumed this caffeine, this energy drink, we said that then the grip strength, the heart rate, the blood pressure, and the oxygen levels will all increase compared to the baseline stats.
So, methodology. This is basically how we did our testing. It was random, so basically we'd walk in a class, we'd say, who wants to volunteer? Anybody. We didn't try to pick a group or anything, nobody with an energy drink, nobody without. We just said whoever wanted to be a participant. So we take them in a controlled environment. It wasn't loud or anything, nothing to raise their any level or anything. And we test all their baselines first. So we sit them down. We had an oximeter. We would do a manual blood pressure test. We would do hand grip strength, and then we'd also take their oxygen and heart rate were on the oximeter. And basically we'd sit them down, and then we test that, and then we give them an energy drink. It was a Celsius. We did Celsius. That was 200, so already double the daily limit, but that's just better results, right? And then so we'd sit them down. We'd give them 10 minutes, so plenty of time. We'd let them finish on their own time, be all relaxed and everything. And then we would test them again right after, and basically we did the exact same test again, and we saw significant changes.
So up in the top left, this is all of our pre-testing and then post-testing, just all the numbers. And here on the bottom left, this is just all of our numbers in a visual representation. And as we can see, all of our pre and post are right next to each other. And we can see that everything increased, but the biggest increase was in heart rate, which jumped from 75 beats per minute up to 100 beats per minute.
So if you really look at it, if you're thinking to yourself, like, why did these kids take these energy drinks? If you really think it's like performance-wise energy, right? So everybody was thinking like grip strength would go up a lot, right? But when you look at it, heart rate really was the biggest increase. And we'll get to that later, how it's going to affect you later on in life. But is it really worth it, like, to take in that much caffeine over just a little bit of change? For, like,
I don't know if you guys can see the numbers, but it increased from 89.7 to 93.4. That's all the increase you got in performance-wise. And whenever you look at that big of a jump in your heart rate every single day, because most of these teenagers are drinking an energy drink, getting one almost every single morning, probably on average at least 5 out of 7 days a week. They're getting an energy drink, they're getting a coffee, they're getting something to get their heart rate pumping that high. And also, whenever you have energy drinkers like that, you're going to build an immunity to that caffeine. It's going to stop giving you that feeling of a burst of energy that you have. So you're going to go from drinking 1 a day, you're going to start drinking 2 a day. And from that, then you start drinking 3. And when you get that high levels of caffeine, your heart rate is going to start beating out of your chest and you're never going to know it because you aren't sitting there watching your heart rate all the time.
Absolutely. So our discussion, this kind of a conclusion of all of our results. The biggest thing was the heart rate jumping from 75 beats per minute up to 100 beats per minute. And if this happens just after 10 minutes, we were really wondering like what would happen after an hour, after 2 hours, after 3 hours. So instead of just seeing that peak, how that crash also affects you. But the big thing about the heart rate jumping that 25 beats per minute is if this happens over time, could eventually lead to irregular heart rhythms, irregular heartbeats, which if that continues over time, if it happens every day, all the way into your adulthood, could be potentially fatal, causing strokes and many other dangerous side effects. So it's very clear that caffeine and these energy drinks have a huge impact on your vitals. So some acknowledgements we just want to have. We'd love to thank Ms. Segal, Mr. Stumpy, and all of our participants for donating their time, energy, and resources to helping us complete this experiment. And then here are all of our resources. You guys have any questions for us?
I have one.
Absolutely.
Why do you think, is it, because it's like a cool thing to do to have that much caffeine, because I think of like my energy level when I was, it was a long time ago, but when I was in high school versus now, like my reason for drinking coffee in the morning is different than what it was drinking Mountain Dew when I was in high school. So do you think it's more for popularity, or do you think that they actually need the caffeine?
Yeah, so I think a huge reason that many students do it is just because they don't take care of themselves properly. They stay up super late at night, and they have to get up at 6 o'clock in the morning to come to school at 7:15. So I think a lot of students, they say, hey, I need this boost to keep me awake, to get me through school. So then that's why they drink all these energy drinks.
Yeah, and then whenever they build that habit of having a bad sleep schedule and they're tired every single day, then their mind says, oh, you need an energy drink every single day. And they don't realize what effect that's having on their body.
That was a good presentation.
Did you distinguish between, first of all, ask anybody if they did have any health issues before they were able to participate? And then did you do any comparison to like athletes versus non-athletes?
So all of our testers, all of our people who volunteered their time and energy, they were all completely random. We came into a classroom and we said, hey, we are doing this experiment. If any of you guys would like to participate, we would love to have you. So they're all random. We did not know any background. We didn't know if they were an athlete or a non-athlete. We didn't know if they normally consume energy drinks or not. So it's just a very, very wide variety.
And
Females and males both?
Yes.
Yeah, females and
And the reason that we did that is because we wanted a true average. We didn't want to just focus the study towards athletes. We didn't want to have, like, we do know that there are health conditions out there that may affect this data, but we want to be including those in the data that we're presenting.
So now what are you going to tell your friends about drinking energy drinks?
So really, if I had to tell my friends one main thing, just like, guys, your heart rate increases through the roof, 25 beats per minute, and you guys are doing this every day. So I would just tell them about the side effects, like, hey, like, this could be potentially fatal in your future.
And your heart's a muscle, and it beats harder, it gets bigger, yeah.
Then we would just honestly ask, like, the question, like, is it worth it to you? Like, are those side effects really worth it to get that 4 pounds of hand grip strength? Or whatever it is that they're looking for. Like, is the slight increase really going to be worth it in the long run?
Did it change your behavior? Like doing that, did it change the way you take care of yourself?
So personally, I am not a huge energy drinker. So I was one of the participants that did it, and my resting heart rate at the start was 80, and then jumped up to 145. I could feel it.
Yeah.
I was like, yeah, I don't think I'm gonna do this.
Yeah.
So.
And I'm on the other side. I'm not like an everyday energy drinker, but I'm like every now and then I'm gonna go get a coffee from Scooters. I'm gonna go get an energy drink from Scooters. Like I'll stop and get a Lotus at Kevlar or whatever it is. And so after doing this, I am much more cautious about like when was the last time I had one of these. Like I do not need to make this a habit of consuming these every single day. And so for me, this was an eye opener to have caution whenever I'm thinking about how many of these can I intake.
What about you, Alec?
Yeah.
Same thing. I mean, I've never really drank personally that much, but every once in a while I'll get those tall NASAs from the gas station, and I feel like it's just like an impulse type of thing. Like they said, I'm up late at night, got to go for school, so I've been trying to cut down on that now too, because I didn't really realize. I mean,
Do they taste good?
Yeah,
I've never had
yeah,
one.
I think they taste good, personally.
You like the taste of it?
Yeah.
Thanks, guys. This was
Thank you.
great.
Yeah, of course. Thank you.
Good morning, welcome.
Good morning.
So my name is Joel Carney. I'm a senior here at Troy Buchanan. I am also an A+ student, CYB volunteer, part of the CAPS program and the PLTW Biomedical Science branch. So for my project, obviously I work a lot with the youth. I am hands-on. I am one of 10 children, so I have 9 siblings, lots of nieces and nephews. So I wanted to focus on the youth of our community. So I kind of was talking to different people. I shadowed at Mercy for CAPS, so we were kind of talking about it, and I saw a lot of kids my age come in, and there were younger kids coming in with issues, and I just kind of wanted to reach out on that. So I went over some old statistics that I found online. I talked to Lincoln County Health Department, and that's kind of where it all started from there. So 1 out of every 6 teenager in our area is suffering from mental health in some way or form. 50% of every mental health issue long-term starts around the ages of 14 to 18. So that's my starting statistics. These are just some more background information. So in our county alone, there's a lot of vaping, there's a lot of bullying online, verbally, physically. There's a lot of issues where I'm an only child, or I have siblings but they're off in college, I'm the oldest child. Who do I have to look up to? So my project is a program I wanted to implant into our school district, and I named it Trojan Buddies because we have a Trojan mascot. So we would pair a high school student with a middle school student. Now I picked those age groups because I feel like high school, we're almost done. That's like the peak of our educational system here. And middle school, I feel like for me, that was the hardest time. I was new to the school district. My siblings are in middle school,
They're new, they're trying to figure it out their ways, and it's very easy to be influenced at those age groups. So for my project, I was going to put those together. So it'd be like a high school who plays football with a middle schooler who plays football. Just to kind of, to give them someone for a support system, but also someone who you could reach out to if you need help with homework. I have lots of siblings, so I'm very academically, I can do it on my own, like I'm good at school, but I struggle, everyone struggles. It is hard for some students to be like, hey, I need extra tutoring hours from a teacher, or my friend's really good at it, why am I not as good, or my siblings are really good. So it's hard for them to reach out to ask for that help. So this program allows them to have someone to talk to about academics, about a group that they're in, or to just get them more involved. So last year's seniors was like Brett Smith, Lucas Boba, all the big names you hear around town. Well, they've already graduated, and I feel like their graduating class, my graduating class, we're very involved, but our freshmen, our sophomores, they're not as involved. I feel that if we were to pair a senior or a high schooler with a middle schooler, it would help to get them involved. Hey, this is what I do in high school. You seem very intuitive. Join HOSA, join STUCO, and this is how it's like. This is what it's like being in those clubs. So I'm originally from Quincy, Illinois. I've been there all the way up until right before COVID, actually. And at my school, we had a program very similar, except for it was like a middle school student and a 5th grader. So at Payson, which is right by Quincy, it's a little town, there were 48 kids in my entire grade, so really small. So their middle school is 7th and 8th grade. 6th grade is still off at the elementary school. So they were paired with a 5th grader to kind of like, hey, this is my last year of here at this school. Let me tell you how it's going to be. Like, I'm going into middle school next year, but you're about to be the top dog, as everyone likes to call it. So just kind of like we read to them and we were there for them, and I really like that idea, and I wanted to implement it here because it's a much bigger community. I went from 54 kids or 58 to 567 in my grade. So I wanted to create a program very similar to get everyone involved and just have a better support. So these are the main 4 topics I wanted to go over with my program that I hope to improve. So involvement, like I said, mental health is a big struggle, and I see it every day. I work with the youth, I'm a senior here. I struggle with it myself. I just wanted to create a program that allowed I know nothing's going to be perfect, but a start somewhere. So to get kind of feedback, because I was like, what's the point? If I'm doing all this and nobody agrees with me, there's no point to continue this. I put out 3 surveys. I did one for students my age, so other students in my class filled it out. One for the community, I put it out on the Facebook pages, and then our teachers and staff. I was like, hey, this is my idea, what do you think? So a lot of people were asking, what do the high schoolers get out of this? Like, obviously it would be good for college, but what do they truly get out of it? So I want to be a pediatric nurse, so for me it's really exciting to have something like this. I get to work with them, I get to understand them more. But we have what we call the A+ program in our high school. So like I was talking about for the football players, you would have someone like, hey, I taught that kid when he was younger, and your legacy kind of gets to continue. But for our A+ program, it's a lot of tutoring hours for graduation. You can get a scholarship for 2 years of community college from the state. So I talked to our A+ coordinator, and she agreed that it was very similar to the class that we do, where we already go out to the elementary schools and we tutor on a daily one-on-one with younger kids, and we would get credit for that towards our graduation requirements. This is some of the graphs that I took from my community survey. So, does your child have an older sibling? Not everyone in the community did it, I understand that. But from the big chunk of people, they have older siblings. But a lot of the comments say, yeah, I have 2 kids, but one of them, she's about to go to college. I'm about to go off to college this fall, and I'm going to be out of state, so it's harder for me to come back to my younger siblings. And then, would you allow your sibling to participate? So there's a lot of maybes, because they were asking questions like, where are they going to meet? Are they going to meet outside of school? Like, are we going to make sure that our
children buddies, older buddies, are they going to be good role models? How are we going to get them to be good role models? And then just, do you think it would help them benefit? And a lot of people said yes. There were some maybes still because it's such a new idea and it's like, are we sure they're the best role models? How is this going to work? Just general questions. And then I just put some quotes on here that really stood out to me because I was like, okay, so maybe this idea is a good idea. Maybe this is something we should have in our community. If we're getting results like this from our community members, maybe this is something we should put out for them. And these are from my peers. So everyone in my CAPS class, we answered each other's surveys, but we also, I had other people answer it. So the first one is just saying, do you think it would help in our county? Do you think students in our school district would benefit? And there's 20 answers, so not everyone. Would you be willing to be someone's children buddies? And for the people who said no or maybe, it was a lot of the texts that I got back were, when would I be doing this? Would it take out from my stats class? Is it taking away from my needed credits? And then do you know of a student specifically? And a lot of people said maybe, and some people said yes. And these are just more quotes from my classmates. And then my last survey was from teachers and staff members here at Troy Buchanan. So a lot of people said yes, some people said maybe. For do you think it would benefit? Some teachers were again are they being pulled out from my class? Is it just during A+ class? Which is all things that would be worked out. And then, do you know of a student? So when I was actually asking the survey for this one, Mr. Nichols, he is the 12th grade assistant principal. He said there's a program kind of like this for our teachers where a newer teacher coming in gets paired with an older teacher to kind of hey, this is your first year teaching or this is your first year here at Troy. I've been here for this long, so how can I help you? How can I be there to help guide you? These are my resources. Do you have any questions for me? Well, thank you for your time today.
Hi guys, my name is Calissa Keeper. I am on the healthcare strand of Lincoln County CAPS. My project name is Selfless Sunshine. I came up with this idea because of the increase of inflation and the struggle for single parents compared to married families because they have one less income in most cases, not all, but most times. The idea is to create a nonprofit organization, kind of similar to a food pantry, but for baby needs, so from infant to 5th grade-ish. And all the items can be donated, and then they can get them at no cost, people who qualify. Local schools, companies, hospitals, daycares, they can all do kind of like a food drive or include it in their food drive to collect diapers, wipes, baby food, all of that to then send to this organization, which can be a building somewhere in town that's like a food pantry with security, kind of like the school with their badges, and they can type in a number, and then there's cameras around it to make sure nobody's going in and taking anything. And then instead of people just coming in and grabbing what they want and then checking with somebody or something, they can, as they qualify and fill out a form, which will be a, not like a tax form, but kind of like an income form to see your income and kind of compare it and see if you are eligible for this. They can also enter the types of things that they would need. And monthly, I'm thinking monthly they would have pre-packaged packages with their diapers, their wipes, baby food formula, all of those things in the package, and they could just come and pick it up and it would be quick and easy for them. The items would be limited per family because they're prepackaged. So depending if you have a newborn, you would get more diapers than somebody with a 1-year-old, something like that. My hopes for this is that the Family Needs Pantry is open to single parents and their children, and they will be able to receive the donated items at no cost. So my method for this was I created the idea and I did a little bit of research on online and on world population to kind of look at single family homes. Then I created a survey and I sent that out to We Love Troy and a couple other like Troy pages. And then I collected the data and I analyzed it, and then I created the poster and my presentation. So for my data, this one is from world population, and I added this one because it shows that the average family size is 3, which could be 2 parents and 1 kid, or 1 parent and 2 kids. It doesn't specify, but and then the average household size is 2.7, but if there's 2, it could be 1 parent and 1 kid, or just 2 parents, no kids. So this screenshot is of, I asked my survey takers which item is the hardest to afford currently or while their kids were growing up, and 30.8% said that is formula, and then 28.2% said diapers and wipes are the 2 biggest things, and then 17.9% for clothing, and then toys, baby food, snacks, hygiene items, binkies, and cribs didn't come in as too terribly expensive, but mainly the diapers, formula, wipes, and clothing. And then 69.2% of the people who took my survey who are from Lincoln County are a single mother or father, and 79.5% of them think that we could benefit from having an organization like this. While single families are struggling during inflation, it's not only them who's struggling. Everybody probably struggles. There are ways that we can come together and try to help each other, especially the schools with food drives and other organizations like churches and stuff. They can really bring people in to like try to donate stuff or any extra things that you don't use anymore. So given the information received, the residents of Lincoln County agree that we could benefit from this. These are my citations and acknowledgements. And yeah, any questions?
How many people took your survey? You remember the total?
It wasn't as many as the rest of everybody.
Oh,
No,
that's
I didn't
okay.
have too many, but
I just wondered how many.
yeah. Anyone else? Thank you, guys.
Thank you. Thank you.
Hi, my name is Hannah, and I'm doing my project over opioid addictions and abuse. And I did a survey with about 50 responses from the Troy community. So I made a survey, and after I made the survey, I decided to send it out to the Troy community through Facebook on the We Love Troy page, and I got roughly 50 responses for all of it. And they all varied differently from how they have lost the loved one and if they have lost a loved one. Lots of them said yes, but from opioids and pain medications. Some had both opioid pain medications and prescription meds, and some also had just prescription medications. Throughout the Lincoln County community, roughly 61% of our community lost people with opioid pain medications and prescriptions that were prescribed. To lower our numbers, roughly 92% of the people said maybe or they did agree. And also I agree with them because truly the numbers are extremely high through Missouri and the United States as well, along with the mortality rates. Through Missouri in 2022, roughly 1,578 people died due to synthetic opioids. And the top 3 counties with the highest death tolls were St. Louis County with 332, St. Louis with 228, and Jackson County with 182. The age group with the highest was 35 to 44, with 432 people dying from opioid addictions. Many people should not have to go through the pain of losing a loved one through this, and I feel like there are many ways we should help and ways that we need to start helping. In the United States, a study was done in 2020 and 2021. Opioids were found that male overdose mortality rates was 2 to 3 times greater than the female mortality rates. And with that death rate, I really feel like we should help everybody and not just certain people. And they should not be tied just to a church so people don't feel like they're going to have to go to this religion with it. And for my plan to help, I feel like we need healthcare professionals who have the professional assistants able to help the people, and they're going to go through rigorous trainings and questions, and we're also going to make sure that they're not judged and they do not feel like they're going to be judged when they walk in, because they're expecting us to be able to help them and help them get better. And we're going to listen to the plan of care that they would like, and we're going to help them work towards their goal for their plan of care. So we're not making the plan for them, it's going to be what they would like to see. And I would like to make like a fun little prize with it. Like every step that you get like a prize, kind of like they do like those little tokens, like when you have a month or 2 months or years. And we can just make it a better prize as we go on. Along with the tokens, I feel like that'll help people want to get more help. And people said that they feel like it's a safe place and they will not be judged, but they also said that if we provide free and reduced fees, which I also like that response, because I do think that some people might not be able to afford the help, and I feel like we should also make it 24 hours. So if like you need help at like midnight, we're still there to help you, so you don't have to wait till like the next morning to just get your help. And I also feel like we should have a bunch of people on hand, so like we can connect with more people at all hours of the day. And my references and acknowledgements, I wanted to thank the Troy community for actually opening up to help with these questionnaires, because that did help with my project a lot. And I want to thank Mindy Kemper, because she was a part of my project. Marilyn Carter from the health department, and I want to thank like the faculty and staff at Troy, because they're part of making this project possible, and they're also helping us get better with our projects. And they're going to help us learn how to speak publicly. And I also want to thank the people who have lost a loved one and also opened up with this survey, because I know it does take a lot, because you have to go through the process of remembering the person. I do think that's a hard topic to go over. And these are also my citations for where I got some of my information. You guys have any questions? Thank you.
Exactly.
All right. Yes, please. So my project is the Safe Haven Health Clinic. Pretty much, the homeless is becoming more of a problem year by year due to the fact that these people are living on the streets. They can't afford health care, don't have the insurance to get the needed care to help them be healthy and well, which is causing them to lose their lives, and they are having to live in pain. Because health care is limited to the homeless out in Lincoln County, I came up with the idea of doing a mobile clinic for the homeless so they can still get the health care they need without having to travel for miles. My hypothesis, or the reason why I want to do this is because I want to help improve the homeless health care in Lincoln County. Some of the things that I did for my project was I researched solutions on how to fix the lack of homeless health care.
I emailed homeless shelters around Lincoln County for more data and what kind of healthcare they needed. I conducted research over homeless healthcare statistics and data. I developed a plan on how to provide the necessary care for the homeless. Homeless healthcare has increased by more than 24% in Missouri alone and has been increased in Lincoln County by more than 5%. They are living with many diseases such as cardiovascular
Deep breath.
You're fine, you're good.
such as cardiovascular diseases, diabetes, hepatitis, HIV, AIDS, substance disorders, tuberculosis, and mental health diseases. The homeless can't afford the proper health care or don't qualify for Medicaid, and most don't, and it's hard to qualify. Homeless weren't able to have access to the necessary equipment to treat these problems, then they would be less of these same problems if they were ever able to have access to them. Seen on this map, Missouri has about 6,000 homeless in the area, and due to it increasing, they will be seen in the darker area in 2 years. Okay. On this, the nearest healthcare centers, there's one in Manchester, which is about 40 minutes away. There's one in Hannibal, which is also 40 minutes away, and Kansas City, which is also about 40 minutes away. So having one in Lincoln County, which will have them one that's nearby, and give them access so they don't have to walk miles, which most of them don't have cars, so we'll have them, don't have to travel. And that map right there shows just how far away the nearest one is. Alright, what the clinic will provide. So pretty much the clinic will have checkups, blood tests, ultrasound. They can have like castings if they have break legs, have broken bones. They can have specialty consults, which I feel like if we did that, it would be on virtual, because most specialty consults are in St. Louis, and most don't want to drive hours to go to a virtual or drive here, so I feel like that would be more online. We can do EKGs, vaccines, pacemaker checks, which that could also be virtual because you can do that online. Chronic disease checks, and also do acute illnesses or infections. And then this is just like a simple diagram. I got this from, I also ended up emailing like a person that creates mobile clinics. And this is like just their simple diagram that they usually do. And like what they provide was like, they have like simple like clinic, they have like an exam table, they have like a medical fridge where like they keep vaccines and like medicines and stuff like that. There's like the drawer, they have like lockers and stuff to keep like the equipment from like patients. They have privacy curtains, stuff like that. They have entry steps, they have vents and stuff like that. Alright. What about the cost? So a mobile clinic costs about $200,000. That's just for like the equipment, being able to get the van, and it also costs about $200,000 annually because that's for the employment, keeping the stock up, and getting like, you know, the gas, the mileage, and all that. And being able to pay for this, keep like donations, the grants, fundraisers, and most hospitals will let you apply for grants, and you can do donations, which if you can find people who would be willing to donate, which most people will be willing if you find the right people, and doing fundraisers, like Lincoln County, I know a lot of people will be willing to do fundraisers in this community because I know there's a lot of good people out here. So, in conclusion, I did a lot of research when doing this project, and in order to see how big of a problem this was, and I did ask a lot of professionals, and homeless is a big problem in Lincoln County. And I feel like having a mobile clinic will really help out the homeless problem, and it will really help out the healthcare, and it will bring down all these problems, and it will help with like the cardio problems and the hepatitis and the diabetes and the homeless, and you know, it'll help them out a lot, and it'll just make them equal with all of us. Clinic will also just make them equal. I think it's just what they deserve because they're also human, and it'll make it right.
And they're just some of the people that I would like to thank. They also helped me with this project, like the Lincoln County Department, Kayla Ritchie, who's someone in Tennessee. I did some national research. And I also like to thank Miss Seago, Christina Gregory with the key. And then, any questions or anything? Okay. And then these are some citations.
The topic of drug abuse is actually very, very prevalent in Lincoln County. We know that a lot of family, friends, everybody sees this, but we don't really know about it until we know someone that has an overdose. A lot of people face many different challenges. We also want this center to have people go and learn about what drugs can do to your body, do to your health, do to the people around you. We also want to learn how to aid people correctly in responsibility and responsive. By the end of the project, we want a full blueprint and plan for a new and local wellness center. We want to help the community understand the consequences, support those that struggle with said drug abuse, decrease the overdose rate that has been skyrocketing in the past year, because through 2021 and 2022 we have seen a 87% skyrocket of overdoses. And that is in Lincoln County specifically, so we want to bring that down. We also want to make a more closer and available center for people, because we don't want people going all the way to Wentzville or all the way out to Ellsbury, because that gives you time to overthink and turn around and go home and not get that help that you need. We also want somewhere for people to go and call, say, I need help. We want to be able to go and pick you up if you don't have a ride or an opportunity. We also want to help the homeless, because homeless, they don't have a ride and they don't have ways of transportation, especially since we don't really have bus routes open to the public. So we would hope to help with that. And personally, I don't think Narcan is a good idea for the public to have open use to, because someone that struggles with drug abuse can go in, grab some, and then overdose and go through the whole process again. We want them to get that help they need and get away from drugs. And this is our data with the 28 responses that we had with the Lincoln County area. We can see that over 3/4 of our graph here, people know someone that has been affected by drug abuse. And most of that is through the community, which is decently small. So everybody knows everybody basically. And then everybody really thinks that most people think that this will benefit people. But it is very sad that people have already passed away from this overdose issue. And we also know that over 50% has suffered from an overdose. And we also know that a lot of car accidents that have happened lately with teens have been due to drug abuse and alcohol. Like, due to one last year, someone was speeding and they were drunk. We don't want that to happen, because we also know that students do bring alcohol to school and drugs to school. That is not a safe area for people who are willing to learn in that. We want people to have a safe area, not be distracted. We want a healthy learning environment. This is our building layout. We plan to have a bunch of bedrooms and bathrooms, communal areas, public areas, conference areas, things like that. So you have an area that is willing to help others that are addicted, willing to talk to others and get the help and support they feel they need. And this is going to be a living area. We don't want we don't want you to have to go back and forth between home and somewhere just to get talk to someone. We want you to have a safe area that has no temptations, no area that has had possible drugs. So we want that to look clean and clear, and we also will have a learning area so people can come and learn about the consequences. A lot of Lincoln County people have helped us with this, and we use a lot of drug dashboard for this. Any questions?
Thank you.
Thank you.
And I'm Katrina. We're both students in the healthcare strain of CAPS. This is our project over a diabetes awareness program. To start with it, we have some statistics that we found. So in 2023, there has been an increase in male and female diagnosis of diabetes. 10.1% of females were diagnosed and 12.6% males were diagnosed. And throughout the years, it has greatly increased within Missouri and within Lincoln County. So that led us to what we wanted to do. We wanted to create a program that could be within schools, that's an extension to a health class, that will let people be more aware of how diabetes develop and how it can affect the body, as well as teach them ways that they can take care of their body while having diabetes. This would be more an extension for a health class, because when I remember when I was in health class, we barely went over diabetes at all.
So, spreading information on diabetes, how to live a healthier lifestyle, that was, if we do that, then it would decrease the growing rates of diabetes for Lincoln County. Because right now, they've grown a whole bunch over the last couple of years. So if we introduce exercising, eating healthier, then hopefully in the next 10 years, 15 years, then it would decrease and go back. So we surveyed Troy Buchanan High School students and a whole bunch of people from our community from ages 17 to 60 plus. And so, as you can see, most people are averagely active, and they don't have the best eating habits. So if we can get this to move over to probably the 7 range, then hopefully it can decrease the rates.
So how we did this, so first we did some research over diabetes and the statistics for it, and see how much of an issue it is. And then we brainstormed some ideas and we came up with this program. And we kind of went over what we would include within this program. And then over a few weeks, we sent out a survey for people to fill out within the community, and we got results from there seeing whether or not a program would be beneficial, and then how well the eating habits and the activeness are for people within the community. And then we're also thinking of ways where we can also include this maybe outside of school so other people can view it if they would want to. Our program that we decided on would go over not just how to take care of, but differentiate between type 1 and type 2. A lot of people may not be able to recognize between type 1 and type 2, and this maybe hopefully would help them recognize it.
So throughout this project, we've come up with a whole bunch of different ideas. So we thought about a website. That was how this all started, was a website on showing off eating habits and recipes. And so we decided a more educational thing would probably be beneficial for our community personally. Just have people sit down and talk about all the different things that you need to take care of diabetes, all the different foods that you should and shouldn't be eating, that type of exercises you could be doing. So, yeah.
And these are our sources. Any questions for you guys?
Why do you think that there was an increase in diabetes?
I think it's just, it could also be healthier foods could be a little more expensive, and with inflation, and then also people are becoming more busy with their lives, so they may not have time to maybe make a good home-cooked meal or something, so they would grab something on the go, or maybe they're too busy or too tired after work to do something like be active, so it's an increase.
Personally, work has a lot to do with it. So if you like go to work, I work full time and I go to school full time. I don't have time to make food, so I usually pick stuff up on the go. So that is a big problem that we have. We don't have healthier restaurants that are like fast and go.
So do you think that those eating not good foods increase in weight may have an
It
effect
definitely
on
has
it?
something to do with it.
Okay.
Yeah, it has an effect to help develop diabetes, and if we could prevent it, or at least reduce it, then we can prolong it or prevent it as much as we can. All right, thank you.
Okay, so we did our project off of the music BPM's effect on heart rate. So to kind of start off, we are both, so I'm a senior here.
I'm Mason. I am also a senior here.
So we're both band students, so that's kind of where we want to start it off. So Mason is majoring in music, and then I'm majoring in the STEM field, and they're very different. So we know how band has affected our lives, and we wanted to kind of see how music affects other people's lives.
We did our, like I said, our project on how different music BPM affects heart rate. So, we're both band kids, like I said. So, we're both band kids, like you said. So, we have a lot of actual band kids in our science thing. So it's pretty cool. Like I said, our project heavily consisted on how well music BPM goes to heart rate. So we had 3 different songs that we actually decided to do. We had a faster BPM one, we had a kind of like middle, medium one that's like 150, and then we had like a control one that was like 50 beats per minute. And do you want to explain the process on how we actually conducted it?
Yeah. So in order to get volunteers, because it's all volunteer-based, so I'm just not going to be like, come listen to our music. So we had students from other science classes come in during our block, and they also had science classes. So they sat down at 2 iPad stations. So they had a heart monitor, they had a coloring sheet in front of them, some of them had headphones, not all of them had headphones, and then all of the markers corresponding to the key that we actually made. So we told them, hey, this is how you read the heart monitor, this is where it goes, this is kind of the situation. They each grabbed a number out of a cup, so we have no idea who is who. We each participated ourselves, and I don't even remember what number I had. It's been so long. So they put in the anonymous number into our Google form, and then they put in their grade level and the gender they identify as.
Okay, so like I said, we had 3 different songs. One was a fast BPM, second one was a middle BPM, and then third was like our control. So we had a color by number page. Like I said, we have a lot of band people also in our science program. So that color by number page, we had the key in front of them. So it was like not that stressful. It was 2 plus 2, 3 plus 3 was, yeah. It was to take their mind off the BPM, because everybody foot taps, I foot tap. So we played the songs for each 2 minutes, and then we also gave them 2-minute breaks where they were not coloring at all. They were just talking and not listening to music. And after every single time they listened to the song, they would put in their end heart rate for that song.
Yeah, so as Mason said, they had 2 minutes to listen to a song, 2-minute break. So while doing our research, we came to the conclusion that 2 minutes when listening to music is typically about how long it takes for the heart rate to move. Obviously, if you're sprinting or running a marathon, it's going to be a little longer than 2 minutes to regulate. But just for the process of the song listening, and because the music we're not jamming out or at the concert or anything, 2 minutes is all they needed.
Unfortunately, this was the color by number page that we used.
Very simple, very cute. I'm pretty sure people were more focused on who colored more in during the 2 minutes than actual.
They were trying to get it done.
Yes. So a lot of our students, as Mason said, are band kids. We're band kids. It is very natural for us to want to match the rhythm. We wanted to focus on what does your heart match, not what are you trying to do, but just what is your heart naturally matching the music. How is it doing it?
So these are the different BPM music for them. So for our results, unfortunately some did get skewed because it was 9 in the morning. Everybody was coming up with energy drinks. Everybody was running upstairs. We had another presentation. One did how caffeine affects heart rates. You had that one earlier. They would sometimes do that one and then go to ours, or they would go to ours and then do theirs. And so it was it happens. Or you have some conditions where you stand up, heart goes down, you sit down, heart goes up. It happens.
Yeah. So after they fill out the information, and obviously we're in class, so there was other things going on, like Mason said, this outer thing. So the heart condition he's talking about, I actually have it. So when I sit down, my heart rate's really high, and I could be at like 112, and I stand up and it's at like 80. So there's different factors. So after we compiled all of our stuff and they submitted their information, they went back to class, we kind of looked at the graphs ourselves and we were like, well, this does not look right for everyone. So this is the medium song, and it was pretty normal. This is like typical high school heart rate levels. And then when we looked at the fast song, a lot of them dropped down. Like this first one was at 58 and now it's at 49. And we were like, whoa, this is really weird, what's going on? So then we did some more research. So because we're so young and we're all developing, our brains are developing and everything else, we found that the brainstem is where sound travels to first. Brainstem also tells your heart to beat faster and your lungs to breathe. So the reason that some of them are fluctuated, that we've come to the conclusion of, is that because we're so young and our brainstems are still developing, it's hard for some people's brainstems to tell their heart to beat as fast as the music while trying to, okay, this is really fast-paced song, how fast is it going? What instruments are playing? What are they trying to say with the music? So for some brainstems and some people, it's just overload. Like you're trying to understand the music, it's trying to tell your heart to beat, your lungs to breathe. So naturally it got stressed out and it just told your heart to be slower instead of faster. Which was like, whoa, that's crazy. We're playing a song by Metallica, why is our heart rate so low? And this is a slow one, so it went back up to 58 from a 49. And this was, I think this is the one where we played Tennessee Whiskey.
Yes.
And that's a really soothing song, so why is my heart rate so high again? And it just goes back to your brainstem is just overloaded. Do you have any questions? These are our resources. And at first we were really back and forth, like, is this right? Like, is this just the caffeine? A bunch of questions that can be answered from our research, obviously. It's 8 a.m., we're both tired. I have 2 jobs, it's stressful. He has a job that he's been at for a year, so it's a lot of stress. So it was really cool to kind of see how, like, we know how music's affected our lives. Mason's majoring in music. I would not be where I am without my music teachers. They have really changed the way that I've seen school just as a regular student. So it was really cool to see how other students are affected by the BPMs that we listen to every day.
And we also would like to thank also our BI teacher, Ms. Sego, for sticking by this crazy idea of what we thought was actually going to not do too good, but it actually proved a interesting result.
Yeah, at first she was like, I mean, you guys can do it, but I don't know how your results are going to turn out, and then she was really impressed.
They did a really good job, and I'm glad you guys pinpointed the caffeine that the other team did, because that definitely will affect your results.
So students in our class, so we have 2 classes in the same classroom by the same teacher.
because it's PLTW, we don't have as many students in the higher ones right now. So she had her junior class and her senior class, and we're all there together. So they all automatically went to the caffeine one because energy drink free, I'll take it.
Yeah.
So it was really cool to see,
That's right.
yeah, it was really cool to see how that changed. So just in their results alone, you could see the BPM change or the heart rate change from the caffeine. So that was really cool to see.
That's a good job.
Yeah.
Thank you.
I like that. Thank you.
One thing that was pointed out to us that if we were to do it again, we would change is the heart condition one. So I only tested one time sitting down. So for me, when I'm sitting down, my heart rate's higher, and it was actually our guidance counselor who was like, maybe next time if you guys use it again, test it sitting down and standing up for the students like that.
Another one that got pointed to me was actually like student athletes. They were like, you should test like control people that don't really exercise as much do, people that are like track athletes. I'm like, yeah, that's actually interesting one, yeah.
There's a whole lot of things
Yeah.
you can like just focus on or try to.
Well, thank you for listening.
Thank you.
Thank you.